Welcome to everybody who has joined our WFSF webinar series. We are very fortunate today to introduce Dr. Tamas Kristof, who will be talking to us about the emergence of medical futures. And it's wonderful, I think, in our community and in future studies is to have all these different streams and interest groups and all that. And we're still under the umbrella of future studies. And even if it's not your strength or your forte or the area in which you work, you still learn so much through that and participating in this webinar series. So welcome everybody to this Friday afternoon webinar series. We appreciate your time. We appreciate your effort for joining. Yeah, just a quick background again. So if you are new to this, I'm going to try and do this in 30 seconds. But the webinar series by the World Future Studies Federation, we started about 3 months ago, and we'll be running it definitely towards the end of the year and then hopefully renew it one way or another. But it's basically and it's inspired from the World Future Studies Federation conference we had in Stellenbosch in October last year. And we had numerous speakers there. I wish we could host all of them on the webinar series, but we tried to gather different interest groups, different speakers who were well received. We invited them to everybody one in a month to talk to everybody and just to kind of open up what we experienced at the World Future Studies Conference last year. And we are very happy so far, and everybody's received it very well. Today, without further ado, Dr. Tamas Kristof, just a quick biography for Tamas. Tamas Kristof earned his PhD degree from Corvinus University of Budapest in 2009. He is currently a habilitated doctor, head of department, associate professor at Corvinus University of Budapest, where research and education of future studies have several decades-long traditions. And we've definitely heard that university often mentioned in the future studies field. Tamas serves as the co-president of the Statistics and Futures Scientific Committee at the Hungarian Academy of Sciences and is a full member of the World Future Studies Federation. He possesses in excess of 140 publications, more than 1,000 independent citations, and over 200 peer reviews. His research interests encompass future studies, machine learning-based predictive modeling, and risk management. And I think that was quite a mouthful. I think I understood about 2/3 of that. I want to say half, but let's go with 2/3. But I'm sure, Tamas, you will take over. And thank you so much for being with us. And thank you for signing in all the way from Budapest. Tamas, over to you.
Okay. Do you allow me to share? Okay, now it must work. One people can share one time. Okay.
Should be able to share.
Do you see the full screen PPT?
We see your screen now, so we can see you.
Not my presentation.
Not at the moment, no.
Then I try again.
We'll ascribe this to Friday afternoon. There we go.
Okay. And do you see the full screen?
We see the full screen, yes. So
okay.
You click, yeah. So we see the full screen with your tabs open on top as well.
Okay. So welcome everybody from Budapest, Hungary. It's 34 degrees. It's very hot here in comparison to South Africa. So I would like to repeat the presentation that I held last year at the WFSF World Conference had in the Stellenbosch University. I presented this discussion in the session of sectoral innovations, which was a parallel session on the 30th of October. And I'm very appreciated that this webinar series was launched, because I heard that many people couldn't simply physically attend the World Conference to South Africa, and due to the numerous participants, we had to share into different parallel sessions. So we only managed to listen to the 1/4 or even less of the presenter there. So I didn't change the contents of the presentations, but there are some new results that was derived from this research topic that I would like to also share with you now. So the initial problem to deal with this problem of emergence of medical future studies is that the future of medicine and healthcare has recently garnered significant attention from the life science community due to remarkable technological advancements in healthcare, the cultural shift in digital health, altering traditional roles of patients and medical professionals, and also there was an increasing necessity to prepare for critical changes in the healthcare ecosystem, as it was evidenced, for instance, in the COVID-19 pandemic. So we see that the paradigm shift is happening in the field of digital health that has revolutionized healthcare delivery, medical practice, and the roles of patients and healthcare professionals, as well as the cultural dimensions of care in the 21st century. All these prompted increased discussions about the future. However, we see that there are several reasons why to address future studies in the field of medicine and healthcare. And the World Conference was about thriving together, as both healthcare and future studies are fundamentally for the well-being of humanity. So although in principle healthcare and future studies should and may thrive together, evidence indicates that medical and healthcare professionals haven't used the principles and methodologies of future studies very often in their work. So even though there are many upcoming approaches that could possibly help medicine and healthcare, it's an unfortunate observation that the medical community hasn't paid much attention virtually to any of them. And what's visible instead is that discussions around the future of medicine, specialties, or therapeutic areas are often rely on the subjective opinions and perspectives of some key professors or key opinion leaders, rather than on future strategies, visions, policies, or scenarios that are grounded in established futures methods. And this observation underscores the need for futures methods to be widely adopted and effectively incorporated into both medical practice and healthcare policy making. So it is widely argued that healthcare foresight can be characterized as an underutilized field or uneven field. It must be at the same time recognized that the sporadic appearance didn't begin yesterday, but roots back to the beginning of the 1990s. I mean, the initial applications of futures methods in healthcare. And the pioneers of healthcare futurists were Trevor Hancock and Clement Bezold, who published several articles even in Futures. These leading scholars initially dealt with vision-oriented foresight in relation to preferable futures, public health transformations, and health systems reform. These two prominent scholars also dealt with healthcare futures in the realm of the Institute for Alternative Futures, which is widely known organization, and later at the World Health Organization. However, after these pioneer works, we can argue that these efforts to introduce foresight and futures methods into healthcare has remained fragmented across some domains and institutions. And there was relatively very limited methodological consolidation within healthcare foresight as a distinct field. And this field, although there are some promising projects and very good published, accomplished healthcare foresight projects, this field is weakly theorized or haven't been theorized at all. So there is a research gap that although there are some promising initiatives and some isolated healthcare foresight projects, but the foundations of future studies haven't been built into these thoughts. So there is a growing recognition in the form of some practical projects, but a conceptual underdevelopment at the same time. And this provides an important point of departure for recent scholarship to deal with medical future studies and healthcare foresight. And because together with my colleagues, we perceive that there are some isolated results and some good publications, we intended first to look into this idea by doing the first scoping review of futures methodologies and published foresight projects in healthcare. And we did this because we saw the potential for using foresight in medicine and the scattered efforts to take advantage of the even greater potential of futures methods. So we investigated sources from 3 databases. First, we considered PubMed because this is the basic database for healthcare-related publication outlets. So we focused on whether futures methods or foresight was used in articles located in PubMed. And of course, we knew that PubMed cannot contain everything that is related to this topic. We expanded the research to non-biomedical journals by using a cross-ref keyword search. And we didn't stop this because of avoiding potential missing targets. We also performed a journal search in the 5 most influential future studies related journals that were classified as Scopus Q1 outlets and also indexed in the Web of Science. Birger, do you have a question?
Tamas, I just want to check. Your slides are not moving. So I'm double checking whether you needed them to move. If not, then perfectly fine.
I share again, maybe.
Okay.
Now, do you see the details of scoping review?
Yes, perfect. I think if you don't mind, if you just want to go back just to the slides, just to give people just a visual background from what you have spoken about, and then we just keep going.
So this was the problem definition beforehand. Okay. Oh. Now it's okay. Seems fine. Okay. Okay, so we utilize 3 sources by completing a keyword search. And we employed several inclusion and exclusion criteria to make sure that we find the most relevant and pertinent articles. We excluded articles that didn't focus on foresight in medicine and in healthcare. We only considered original studies and review articles. It was set as a requirement for the articles to use established and recognized futures methods like trend analysis, Delphi, backcasting, policy analysis, technology assessment, scenarios, or horizon scanning. And we had to exclude several pieces of sources when although the search term located articles, but the context was not at all linked to futures or foresight in the field. For instance, if visual foresight in optometry, if it's foresight but not the foresight that we were looking for, we screened out those articles, and we also screened out editorials, viewpoint articles, book reviews, and journals for which no peer review took place. So in the end, we located 59 articles. It was done at the end of 2023. So other articles that were published later in 2024 and 2025, we included into our newest article published in the European Journal of Futures Research that I will show you that in the recent 2 years, very, very good progress has been done in publishing healthcare foresight relevant articles in leading sources. And after we selected the sources and analyzed and read them through and completed the scoping review, we managed to identify 5 research clusters owing to the thematic analysis of the papers. The first research cluster, it was called as National Strategies. It contained articles that are mostly about how health-related problems, opportunities, and trends evolved in specific countries. They give advice that is specific to the healthcare system, population, culture of certain countries. And these studies demonstrated that futures which may have an impact on new healthcare practices and innovation. The second research cluster was called Strategic Healthcare Foresight. These studies used methods from the futures field to look at medical scenarios, trends, and problems that might arise in the future. They look at a lot of different things and often think about big issues that might affect the medical field as a whole. They talk about the strategic uses of futures methods in healthcare, covering topics like ethics and innovation or sustainability or collaborative approaches. And the next research cluster we named Healthcare Policy and Workflow Dynamics, which included studies that look at the impact of government policies on healthcare and how healthcare professionals are managed. These articles addressed plans and possible changes that could affect how medical governance and human resource management should work in the future. And they also talk about how hard it is to get the healthcare workers ready for the difficulties of the futures. And of course, they also addressed how to change the health system and how to train medical professionals and different policy options for how the future will affect healthcare. And then a very popular research cluster due to the COVID pandemics was called as Pandemic Preparedness and Response. These studies looked at issues linked to infectious diseases, focusing on vaccination strategies and challenges posed by the COVID-19 epidemic. And it was interesting that infectious disease spreads are talked about in these articles in terms of possible futures problems and ways to handle and stop them. And studies demonstrated how it is important to use futures methods in planning for and responding to pandemics. And finally, the last research cluster affected specialized medical domains. And this team is about specific areas or disciplines within medicine, such as personalized medicine, oncology, or biotechnology. And these articles went into great detail about these subjects, and they showed how futures methods can be used in many different areas of medicine, from encouraging new ideas and strategic planning to giving healthcare professionals better information to have them make underpinned decisions. So these were the most important clusters of this scoping review. And then we elaborated the detailed discussions by use of the findings of the scoping review, which was, I think, the most successful part of the published article. And we grouped the discussion elements into two main things. The first, why is it healthcare that needs future studies? And the second grouping, why does healthcare need future studies? So several discussion topics were mentioned and concluded. The basic things is healthcare is undergoing a rapid technical and cultural upheaval, and medicine relies on technology, and healthcare technology advances rapidly. But this is the area that futures methods can really help to anticipate the impact of emerging technologies such as AI or gene editing or telemedicine that will surely affect healthcare delivery, patient outcomes, and the healthcare landscape. There is a problem, a general problem in the field of healthcare is the aging demographic concerns, and innovative solutions should be needed to aging population. As the global population ages and healthcare demands become more complicated, and futures focus research may assist in identifying and assessing the healthcare requirements for aging populations. Rising healthcare costs is another issue. Future-oriented research can explore ways to make healthcare more efficient, cost-effective, and accessible. And we cannot avoid the helper's health, that it also matters whether helper's health is okay. So it's important to note that overworked and burned out healthcare providers hinder patient healing. Future-oriented research may help healthcare personnel reduce their workloads, improve their well-being, and offer the best patient care. There are several others, so I think it's worth reading this scoping review, as it threw light on several issues that might be resolved by the help of future studies when futures approach and methods are well employed in healthcare. And after the broad discussions, we developed conclusions from the scoping review. It demonstrated that what various futures methods are available to the medical community, but we also emphasized the unexplored possibilities, the untapped potential these approaches possess in transforming healthcare planning and policy formulation. So it was concluded that, okay, there are some promising initiatives and research clusters were possible to be analyzed, but future studies has been used either sparingly in healthcare, concentrating on some specialized areas, and also infrequently, addressing topics related to, for instance, national strategies or the healthcare workflows. After analyzing those selected articles, we concluded that overall 8 futures methods were already applied in Q1 publication outlets in different healthcare domains, but we know that more than 50 futures methods exist from the Millennium Project, from the Houston, and from other sources. So it is another untapped potential. What other futures methods could be applied for different diseases within healthcare? And the main conclusions at the end of this discipline within the expansive domains of healthcare, medicine, and life sciences, we predefined that this pioneering branch is envisioned to be committed to the systematic application methodologies with the that we considered it simply as a lost opportunity. And we propose that the integration of future studies has the potential to greatly improve and advance medical science by filling a crucial gap in accomplishing well-founded anticipation, innovation, futures literacy, scenario formulation, visioning, and strategic planning. After we published this scoping review, the first person who notified me that he would be interested in more details was Rom Gayuzo, who is well known in these circles, who's a media star at the Futures Television. He invited us to make an interview as a part of the In Focus television show. We shared the findings and the most important conclusions and discussions from the scoping review with the audience. And this interview was shared in the WFSF mailing list, which was viewed and seen by many interesting participants. And after that, Rom helped us to disseminate the results. The Journal of Medical Internet Research, which is one of the most high-ranking publication outlet in healthcare, it contacted us to launch a special issue in the field of emergence of medical future studies, because they saw business in it. So it's a very business-oriented healthcare journal. And I would like to show you that currently, just wait for not this. Do you saw the special issue? Okay. Okay, so when I hold this presentation at the conference, there were only 3 published articles in this special issue. Now we have 12, and we were dreaming of only 10. And there are still some manuscripts under review or under consideration. So it was the first ever special issue in a healthcare journal to cover future studies and the use of future studies in medicine and healthcare. So it is deliberately seen that traditional or past approaches are simply insufficient to address the future challenges. And simply, this is the right channel to integrate futures methods into healthcare and to navigate the evolving landscape effectively. we have defined the requirements, what papers we saw. We desk rejected predictions, we desk rejected opinion leaders. I will tell you what the future is. No, we stick to deal with manuscripts that respected the established futures methods. And I think better and better articles were already published in these special issues. And as you see, there is, for instance, a future wheel study. There are some generative AI mapping study, a scenario planning framework study. There is a horizon scanning study for an innovation framework, a backcasting study, another horizon scanning study, and a Delphi-based study. It was a qualitative expert panel-based study, participatory design approach, and are collections of the futures methods, technological integration, or other qualitative analysis. So I think we are on a good track to finish this special issue. The acceptance of manuscripts was closed by the end of March. I'm expecting 3 or 4 more articles here, and we will see what feedback we will receive from the medical community after it will become worldwide visible. I would like to get back to the presentation. No. Do you see the next slide? How to use selected futures methods?
At the moment, I see the theme issue launched.
Okay, then I know.
Selected
Share.
features.
Okay. Okay. No. Okay. And as a part of this special issue, we had the opportunity to write an editorial piece, but we didn't want to write just a short editorial piece. We wrote a methodological paper, how to use selected futures methods in healthcare. We considered selected futures methods as dimensions of this paper. Basically, we defined futures methods. We have written what they are for and selected case studies from the medical or healthcare field for what purpose they were utilized. We have written it before we received the manuscripts. They gave additional cases to the community. It was concentrated on years before 2025. And we managed to conclude that, of course, these methodologies shall not be used in an isolated way. They must be combined, as in every future studies project, to deepen the research and to merge the benefits of distinct methods, yielding more reliable outcome than when using these methods separately. So we managed to find the futures wheel as a very promising technique, scenario analysis, backcasting, and we concluded also that the futures wheel, the scenario analysis, and the backcasting is practically for free. Anybody can use it. Doesn't require funding. Anybody can use it with a pen and with a flip chart to draw a futures wheel or to draw a scenario logic and to elaborate different scenarios. And this was the most sympathetic conclusion that I received feedback. As you know, healthcare is underfinanced in countries like Hungary, and they were happy to see that there are useful research methods for free. It doesn't require laboratory. They don't require expensive experts and computational systems. So I didn't expect that it was the most promising conclusions, but my experience showed that they saw the potential because of the cost effectiveness of futures methods and the usability of futures methods in their daily work. I share again because I see that. Okay, the calls to action, am I right? Okay. So after we investigated with the scoping review how futures studies were used in healthcare, and after we wrote a normative methodological paper how to utilize futures methods in medical and healthcare context, we formulated a calls to action how to integrate widespread adoption of medical futures methods. And we developed the following key actions, which can be seen in the table. The first action is that we propose healthcare institutions to form a dedicated medical futures team by formally appointing a team of futurists. We know that no futurist exists in a hospital or in a healthcare institution. We propose at least some future-oriented people who oversee the integration of future thinking within the institution. And then the next action item is to improve futures literacy by incorporating the fundamentals of medical futures methods into staff training and upskilling to develop an anticipatory and proactive mindset. And then we proposed to ensure policy integration and embed future thinking in the institution's main projects and decision making. And when it's done, then we recommend building research network based on the knowledge base by conducting academic research involving medical futures methods within the institution and with collaborators, and share the findings to help develop field-specific frameworks and best practices. And then what's even more useful is to practice futures methods and exercise simpler ones just as a scenario analysis or a futures wheel in brainstorming session without the need for practical outcome, just to make use of and gain experience in these simple methods. And at the end of the article, we formulated the future direction of the improvement of futures methods, including generative AI, LLM, so on and so forth. Doesn't I share it? You see? Okay.
Yeah, we see the Hungarian case study.
Okay. At the time of the World Conference, this project was already accomplished, but wasn't written in anywhere. So I managed to only say a few sentences about this project. It was a vision building exercise for the Hungarian National Ambulance Service, which has a workforce of nearly 9,000 people, and yearly they manage 2.3 million patient care cases. So in the context of a small country, it is a big foresight project that was accomplished. It was initiated by the general director of the National Ambulance Service because an increasing awareness was raised within the leadership of the ambulance service that the previously implicit or informal future assumptions were no longer sufficient to navigate the rapidly changing healthcare landscape. And the organization encountered heightened pressure from multiple directions, like disruptive technological innovations, shifting demographic trends, climate-related operational challenges, and evolving public expectations around accessibility and compassion in emergency care, and the growing patient demands, of course, which is witnessed globally. It's not a Hungarian specific program. And it was found that a noticeable absence of a cohesive long-term vision was missing from the organization, which served as a framework for strategic planning and workforce development. So the leadership recognized the necessity to realign the organization's future thinking in response to these factors and to adopt a proactive stance instead of the reactive one. And we developed this project by combining 4 futures methods. We balanced the structured analysis with collaborative creativity. We began the process with a steep analysis to establish a shared understanding of the broader forces shaping the future of emergency care. And then we continued by a scenario development to explore the plausible futures based on key uncertainties and drivers. And then we deepened this analysis by the futures wheel by examining the second and third order consequences of a critical technological milestone, namely the AI integration into the National Ambulance Service operation. And then the process concluded with a vision writing exercise that facilitated the translation of foresight insights into a narrative to inform strategy and communication. All the top management participated in this foresight project. IT, AI expert, we had the communication director of the service, also a legal expert, and a patient representative also present. This was the first time in Hungary that the patient was ever involved in a strategic project in healthcare. They were overlooked simply beforehand. And this foresight project yielded concrete and actionable outcomes for the National Ambulance Service, and the urgent need was highlighted to advance the organization's digital infrastructure, to improve the digital literacy across the staff levels, introduce new competencies in communications, psychological resilience, and technology adoption. This is a sample futures wheel, which was highlighted in the project. And now the situation with this project is much better than at the time of the World Conference, as on the 8th of July, my article was published by the European Journal of Futures Research. This is one of the few selected papers of the conference presentations that was selected to be published here. 10 days have passed since its publication. I'm very surprised by the high accesses on LinkedIn. Such a deep discussion was introduced that I rarely saw in my former articles. So now every details of this project can be read. And of course, Cape Town is mentioned, WFSF, everything is mentioned to put into the right context how to make it better. And I made up for the recent 2 years in the literature review, which was naturally missing from our 2 year prior scoping review. So we provided the scenario logic, the process of the foresight. So it was a rapid process. I can share with you. Luc van der Laan was the guest editor, and so now it's a Q1 very high-ranking journal article. And to conclude this presentation, we reconciled with Berger 50 minutes. So now I have 2 or 3 minutes left. So what are the main messages of these presentations? So based on these results and the successful Hungarian case, we can argue that analyzing the future of medicine and healthcare should rely on the systematic exploration of future scenarios through well-defined guidelines and established methodologies in future studies that medical professionals, life science researchers, healthcare and patient leaders can adopt and use. And such methods could get integrated into medical curricula and adopted by policymakers, medical journal editors, which would be for its widespread instruction. And while the future might seem, many cases, like an unpredictable force beyond our control, we truly argue that established futures methods provide the tools and specific research design that could improve how the research and implementation of digital health are guided. And this capability and futures literacy is especially crucial in an era marked by rapid technological progress and cultural transformation. And I think there are well-established futures methods, and now we manage to tell for what purpose they may be utilized in healthcare and medical contexts. And we will not give up until we achieve the establishment of this medical future studies subfield. Its establishment is both timely and essential in our opinion. And this is the end of my presentation. Thank you again for your attention.
Yeah, thank you so much, Tamas. Again, I think what I said in the beginning is so true again. I mean, we all come from different fields in the future studies, which is first and foremost why it's such a welcoming community, I have found especially. And then we sit in presentations like yourselves, and even though it might not be our expertise or sometimes even not our main interest of or area of interest, we learn so much and we consolidate so much of what we have learned in a different area. So thank you so much for taking us through this journey that you have been on. And that is, my guess is it's probably just starting in a real sense in the futures and the medical field. So thank you so much for spending the time with us, and thank you so much for all your insights. We have one question, and Michael, if I can ask you, maybe just, if you don't mind, you're welcome to just pose the question to Tamas instead of me just reading it out. If there are any other questions, you're more than welcome to also just raise your hand, and then Tamas, you're welcome to take them, and I will just be on the backup if you miss them. Michael.
Thanks, Birgit. Dr. Kristof, can you hear me?
Yes.
Thank you. Just listening to your talk and the fact that it was based on medical futures in South Africa, you might be aware of the proposed national health insurance scheme to take over the managing medical services in South Africa. It's highly controversial. I just wondered how familiar you are with it, and if you have any suggestions or insights as to how medical futures could be applied to the South African context.
Well, I was only one time in South Africa last October. I don't know much details about it, but But I think the perspectives are not bad. Much better than 10 or 20 years ago, when only conventional healthcare policymakers with conventional techniques and approaches told predictions and simply told what the future will be. And even if they knew that they are not true, nobody dared to tell anything against them. I think currently, in the time when everything is available in open source, there from the UK or from Netherlands or from USA, there are very good examples how foresight perspectives were adopted by healthcare policymakers. So there are good examples, even for those who never heard of future studies. Just read the UK or the Netherlands case.
Thank you.
Tamas, you might also, while there might be others who want to ask questions, please feel free to put up your hand. And in closing, because we're looking forward next month to Alicia Maybach, who is also in the webinar at the moment, and she will be talking to us about the technologies of the future in science fiction. And we have it in our diaries for July the 15th, but we just have to confirm a time. It will most likely be later in the afternoon, European and South African time. And then obviously will have an impact on the rest of the world. But Tamas, thank you so much for this very insightful presentation that you have done. I think, as I know, there's some of the Institute for Futures Research scanners here as well. So who knows, we might have to have a special section or a special edition of scanning in terms of medical futures out soon as well. But please feel free to connect with Tamas. Thank you so much for joining us, wherever you might in the world.